I'm Gail Martino. I'm a certified genetic counselor that works in the Hereditary Cancer Center here at Duke. The purpose of my job is to go ahead and counsel patients and their families in areas where we might suspect that they have hereditary cancer. So a patient that has breast cancer, we might meet with them to determine whether or not they might have been born with a gene that puts them at higher risk for developing cancer. Or for a patient who has a family history of breast or colon or other cancers, we might take a very detailed look at their family history to see whether or not genetic testing might be warranted to give us a better idea of what could be causing the cancer in that family. When a patient comes to meet with me as a genetic counselor, one of the first things that we'll do is we'll sit down and take a very detailed personal medical history, but also family history. So we're truly trying to get a clear picture of what their cancer history has been, but also the cancers in their family. We look at their brothers, their sisters, nieces, nephews, children, parents, aunts and uncles, and even grandparents to try to figure out, do we see any type of pattern of cancer within that family? And then we really sit down with a very personalized approach based on their medical and family history to try to figure out what we think are the most concerning aspects of their family and whether or not we think their family history could be related to an underlying hereditary disorder. One of the things that I get the pleasure of doing is, doing genetic testing, but giving them an insight to what might have caused what's happening in their family, but also giving them that information so that they can use it to help improve their care. So by empowering these patients, we're able to give them the information that, hey, okay, yeah, I have a gene that puts me at high risk for breast cancer, but there's also things I can do to try to reduce that risk or try to detect it early. And so we are also able to provide them that information to hopefully really change the outcome of the disease or even prevent it from ever occurring.